Module 14, Oncology, Immunosuppression. Content 1, Basic Terminology. Terminology, Clinical Setting Application. Content 2, Personal Attitudes about Cancer and AIDS. Personal attitude about cancer. Personal attitude about AIDS patients. Importance of treating all patients with respect and avoiding judgmental attitude. Different types of loss. A. Loss experienced by the patient. Loss of a body part. Loss of body function. Loss of expected outcome. Alteration in body image. B. Loss experienced by the family or significant others. Sudden loss from an accident or unexpected death. Content 4, Risk factors and early warning signs associated with cancer. Risk factors include diet and alcohol, lifestyle, stress and obesity, age and heredity, drugs, recreational or hormone replacement therapy, unprotected sex with multiple partners, smoking or chewing tobacco, occupational exposure, such as to hazardous chemicals or radiation, exposure to sunlight. Early signs and symptoms of cancer include change in bowel or bladder habits, a sore that doesn't heal, unusual bleeding or discharge, thickening or a lump in the breast or elsewhere, indigestion or difficulty swallowing, obvious change in a wart or mole, and nagging cough or hoarseness. Common cancer treatments and related side effects. A. Surgery. Weakness, pain, fatigue, risk of infection. Mastectomy. Colostomy. Head and neck surgery, such as a tracheostomy or artificial voice box. B. Radiation. Rash. Reddened skin, fatigue, loss of appetite, increased risk of infection, low white blood cell count, fistula, nausea and vomiting, diarrhea, and change in taste. Chemotherapy. Nausea, vomiting, loss of appetite, mouth sores, hair loss, change of taste, increased risk of infection, loss of fertility, either temporary or permanent, loss of libido, anemia, fatigue. D. Biological therapy or immunotherapy. Flu-like symptoms, weakness, nausea, vomiting, decreased appetite, diarrhea, and fever. Rash, swelling, easy bruisability, shortness of breath, and rapid pulse. Content 6. Describe general nursing care measures for cancer patients. A. Pain management. Care of patient with PCA or epidural. Safety measures. Refer to Module 4, Objective 8, Care of the surgical patient. Mastectomy. Do not take blood pressure on site of surgery. Colostomy. Empty bag frequently. Do not change skin wafer. Only a licensed nurse can perform this function. The nursing assistant should never irrigate a colostomy. Some complications of colostomies include skin breakdown, blockage, obstruction, stomal bleeding, and stenosis. Nutrition. Mouth sores, dry mouth, poor appetite, nausea, difficulty swallowing, changed sense of taste and weight loss. Small frequent meals. Serve food high in calories first. Encourage foods that are easy to eat and digest, such as pudding, Jell-O ice cream, custard, or milkshakes. Offer high-protein supplements as ordered. Set attractive table. Make sure bedside area is neat and clean. Elimination. Diarrhea and constipation. Frequent toileting. Offer frequent fluids. Accurate input and output. Good perineal care. Rest and sleep. Easy fatigability, anxiety, pain, and night sweats. Ensure quiet environment. Group treatment and care measures to allow rest. Back rubs. Mild exercises allowed. Altered coping patterns. For stress, anxiety, fear, depression, and confusion. Active listening. Provide reassurance and support. Encourage patient to talk about feelings. Notify nurse of ineffective coping. Chaplain or social worker. Relaxation exercises. Review standard precautions. Wear extra thick latex gloves or 2 pairs when handling bodily fluids to prevent exposure to chemotherapeutic agents. If there's a high risk of splashing or direct contact of body fluids with skin or clothing, wear a gown, mask, and protective glasses. For handling hazardous materials, refer to Module 3, Objective 8. Content 7. Special care measures for immunosuppressed patients. Types of immunosuppressed patients are cancer, AIDS, or transplant. Transplant patients are immunosuppressed due to medication they must take. These patients often require the same care as cancer patients. Purpose of and precautions for patients with low platelets. Avoid sharp objects. Use soft toothbrush. Urine dipstick for blood per hospital policy. Avoid straining with bowel movements. No enemas. No shaving with razor blade. Check for signs of bleeding and report promptly. Hold venipuncture site 5 to 10 minutes. Purpose of and precautions for patients with low white blood cell count. Thorough hand washing. Restrict food. Check hospital policy with licensed nurse or dietitian regarding whether or not the following should be restricted: juice from multi-serving containers, fresh fruit or raw vegetables. Check with nurse or dietitian regarding foods from outside the hospital. Restrict visitors with cold, flu, or any other sign of contagious disease. Request reassignment when feeling ill. Nursing personnel should not come to work if they have a cold, flu, or other communicable disease. No fresh-cut flowers or live plants in the room. May require reverse isolation or precautions. Mouth care. High risk for mouth sores and infections. Increased frequency of oral care. Special rinses needed for pain relief or to treat infection. Resource personnel include oncology nurses, social services, chaplain, dietitian, infection control nurse, transplant nurse, or coordinator. Content 8. Role of nurse assistant when caring for a patient receiving radiation therapy. Learn the purpose and care of radiation marks. Avoid washing them off. Learn about skin care needs. Wash radiated area gently with lukewarm water. Possible limitations in using skincare products. Patients with radiation implants. Review hospital policy regarding use of radiation badge when in patient's room, disposal of wastes, and limit time and distance with the patient. Content 9. HIV infection, AIDS related to transmission, signs, and symptoms. HIV transmission. Blood to blood by transfusion. Treatment of hemophilia, needle sharing, accidental needle prick, and unsterile instruments. Unprotected vaginal or anal intercourse when one partner is infected. Infected mother to infant, pregnancy, birthing process, and nursing. HIV infection, first phase, asymptomatic incubation period, 4 weeks to 6 months. May or may not have HIV antigen, which can be detected by blood test. Second phase, symptomatic period, flu-like symptoms to severe symptoms. HIV antibodies now detectable with blood test. Third phase, asymptomatic HIV infection. Prolonged asymptomatic period from 1 year to 15 or 20 years. Decline in immune function. Fall in T helper cells. Fourth phase, onset of symptoms. Persistent generalized lymphadenopathy. Low-grade fever, night sweats, diarrhea, swollen glands, weight loss, and peripheral neuropathy. Fifth phase, common signs and symptoms, weight loss greater than 10% of body weight and anorexia. Fatigue, current diarrhea more than 1 month, bloody stools, fevers, chills, night sweats, muscle aches, white coating or spots on tongue, enlarged lymph nodes, frequent or recurrent infections, such as tuberculosis, candidiasis, pneumonia, herpes, neurological signs, such as altered mental status, neuropathies, Kaposi's sarcoma, purple growths on or beneath the skin of feet, ankles, and eyelids. CDC criteria for diagnosis of AIDS. CD4 plus cell count below 200. 23 opportunistic infections that define an AIDS diagnosis. The most common are pneumocystitis carinii pneumonia, Kaposi's sarcoma, oral thrush, tuberculosis, cytomegalovirus retinitis, colonitis, or pneumonia, persistent generalized swollen glands. Content 10. Special nursing care measures for the AIDS patient. Psychosocial needs. Sensitive to needs and emotional status of patient, not judgmental. Positive attitude and good interpersonal skills. Encourage the patient to express feelings. Allow patient participation in decisions for care. Encourage visits from family and friends. Respect patient's choices. Maintain confidentiality. Respect autonomy of patient. And be aware of grieving process and possible suicidal thoughts. Infection control. Protect patient from infections. Standard precautions for protecting nursing staff. See Module 3, Objective 6. Nutritional needs. Poor appetite, sore mouth, fatigue. Monitor food and fluid intake closely. Accurate weights as ordered. Give nutritional supplements as ordered. Small, frequent meals are the best. Good oral hygiene and pleasant eating conditions. Observe for swallowing difficulties and notify the nurse. Skin integrity. Inspect skin and mucous membranes daily. Turn at least every 2 hours or more, often if needed. Prevent scratching. Keep nails filed. Notify nurse of itching. Use only a mild soap. Avoid too frequent bathing and shampooing if skin is very dry, but provide often enough for good hygiene. Good oral hygiene, soft toothbrush, diluted mouthwash. Elimination. Diarrhea or constipation. Encourage fluids. Record accurate input and output. Change linens as needed. Good perineal care. Sitz bath if ordered. See Module 5, Appendix 5.6. Safety and comfort. Check vital signs as ordered. Observe patient for any unsteady gait. Remove safety hazard if patient is weak and unstable. Assist with ADLs as needed. Remind patient to use call light and to ask for assistance with transfers and toileting as necessary. Setting up a chemo room. Equipment. Chemo hazardous waste hamper. Chemo hazard trash bag. Door warning signs. Sharps container and box of latex gloves. Criteria. Obtain equipment. Place chemo hazard bag in hamper. Place chemo warning signs on door of patient room and bathroom. Know where the chemo spill kit on the unit is located. Put on gloves before touching any contaminated material. Puts on gown and protective eyewear if in contact with or splashing of contaminated material is likely. Flush all urine, stool, and emesis and any other bodily fluids twice for up to 48 hours after last dose of chemotherapy. Place disposable chucks as a protective barrier between incontinent patient and linen. Wash hands after removing gloves. Wash hands after touching patient and before caring for another patient. Dispose of chemo trash bags in dirty utility room and call for environmental services for pickup or follow the facility policy. Use hazardous material precaution when handling linen contaminated with bodily fluids. Call the environmental services to pick up linen for decontamination and reprocessing or follow the facility policy. Place all sharps, IV bags, and tubing immediately into sharps container and seal container for removal from room. Document chemotherapy precautions on appropriate chart forms per facility policy. Self-assessment of personal attitudes about cancer, AIDS, and death. Is body image important to you? Do you fear the diagnosis of cancer or HIV? If you were diagnosed with cancer, would you feel depressed, defeated, or fear that you would die soon? Or would you see it as a challenge and want to fight with all your being? If you had cancer, what would be your greatest fear? Pain? Disfigurement? Not being able to participate in normal activities? Not seeing your children grow up? Or death? What do you think are cancer patients' greatest fears? If you had just been diagnosed with cancer, who would you want to talk to? What things would need to be settled? What plans would you need to make? How do you feel about AIDS patients? Do you experience fear, paranoia, or disgust when having to care for them? Does it bother you that law enforcement gives an AIDS patient more privacy protection than it gives you a right to know their HIV status? When talking with cancer or AIDS patients, are you nervous or anxious about saying the right thing? Do you fear saying the wrong thing to a person who is dying? How would you like someone to respond to you if you were dying? Thank you for your attention.